Hey, Sophie, welcome to the show.
Hi, Brittany. Thanks for having me.
Yeah, I am really excited to have you on the show. This is going to be a topic we actually haven't covered yet after over 100 episodes, which is crazy, which is
Wow.
emerging markets. And so let's start off with your background. Tell our listeners, where are you from? What did you study? What's your career? And tell us a little bit about if you're living in an emerging market right now, what's inspired you? Tell us just a little bit of your personal story.
Okay. So I actually read history at Cambridge. I don't have a medical background. I have two parents who are doctors. My father, until recently, was the National Clinical Director of Diagnostics for the NHS and ran one of the NHS's first big digitalization programs called PACS to bring all of its imaging online. So I think I've always had a very deeply rooted interest in diagnostics as a result. But I read history and then I worked as a technology consultant for 4 years for Accenture. I left in 2014 to found my first company, which was a health tech consultancy based out of the UK. I then set up a doctor finding appointment booking platform in Pakistan with a guy, Pakistani origin, who I met in London. That platform was called myZindagi. And then I went from there to setting up a software development company, primarily focused again on healthcare technologies, set up a plastic recycling company in Sierra Leone that does waste plastics to bricks, cars, and roads. Bounced quite quickly from company to company. Both the doctor finding appointment booking platform and the plastic recycling company are still going strong under my business partners. But none of these was the company for me. And then I moved to Dubai with my husband in September 2016. I was newly married and pregnant, and I went to speak at a conference that a friend of mine had organized in Kuwait on diabetes. And we didn't discuss diabetes at all. Instead, we exclusively spoke about the fact that I was pregnant. And about a month later, he pinged me with a whole load of stats on women's healthcare in the Middle East and North Africa and said, do you want to do something in women's healthcare together? So I said, yes, sure. Give me a few months to hand over my existing business interests and have this baby. And then my son was late. So we actually got started on Nabta on the 21st of March 2017, which as it happens is Mother's Day here in the UAE. So that's how it came into being.
Wow. And so you moved to Dubai because your husband had a job there?
I did. He's a commercial litigator working with one of the largest, if not the largest Arab law firm here. So yes, as is the case with many women here, I moved with my husband's job.
Got it. And so during your pregnancy, did you have an expectation of what healthcare in the Middle East for maternal health would look like? And did it match your expectation?
So I actually had just started seeing doctors on the NHS before I moved out, and we were a little bit back and forth in the first 6 months. My husband initially had a temporary 3-month contract, so we were back, and I had Oliver in the UK, and then I had my second child, Eleanor, here in the UAE. The third baby will also be born here in the UAE.
What about like culturally? Was there any differences? Giving birth is a really vulnerable and intimate thing. Did you notice that there was any kind of, cultural differences there?
I don't think there were any specific cultural differences. Again, Dubai is the United Arab Emirates is a country of 200 nationalities. It's incredibly diverse,
Yeah.
probably one of the most diverse countries in the world. And a lot of the healthcare ecosystem is very westernized. There's kind of a precedence placed on names from the US and from Europe. So Sheikh Shaqut Medical City is a big collaboration here with Mayo Clinic. We've got Cleveland Clinic, Abu Dhabi. We've got King's College Hospital, London. And a lot of the doctors are American board certified or have come from one of the royal colleges in the UK. So the actual caliber and kind of the cultural diversity of the medical staff is no different, really. The main thing is this highly commercialized aspect.
Mm-hmm.
So you spend a lot of time second guessing the care here because you genuinely don't know whether something has been prescribed because it is needed or because it's the most effective money-making mechanism for the parties involved.
Got it. And so what do you define as an emerging market?
I would say an emerging market is, in general, a lower or middle income country. So the Middle East, Africa, and South Asia, which is our target market, it's about 645 million women between the ages of 18 and 58. It's actually very diverse. You've got places in the GCC like Qatar and Saudi Arabia, which have some of the highest GDP per capita, so some of the wealthiest people in the world. And then you've got places like Yemen, where half of the population is starving, through sub-Saharan Africa, a lot of people taking home less than $1 per day, living below the poverty line. So the region as a whole is very diverse, but I think, it's very nascent from a healthcare ecosystems perspective. Most of the countries here are young, and a lot of them don't have established infrastructures. And so they're building healthcare systems that are almost entirely technology enabled from start to finish. They don't have a lot of the legacy issues that healthcare systems in other parts of the world have. I think there are some countries in the Middle East that would classify more as emerging market than others. But in terms of being a nascent and sort of untapped market opportunity, emerging applies to the whole region.
And so emerging markets having lack of infrastructure existing already, how does that affect women's health specifically?
Oh, in a multitude of different ways. To give you so there are a few things. Firstly, there are significant taboos associated with many aspects of women's healthcare here, particularly any hereditary conditions, anything relating to fertility. So a lot of women are very hesitant to talk about their health, to seek advice and assistance, and as a result, healthcare outcomes are quite significantly impacted. Just to give you some stats, 80% of breast cancers in the MENA region are diagnosed at stage 4, which has a 27% 5-year survival rate versus stage 1 or 2, which are 99%. 40% of women don't attend a single antenatal appointment, which obviously greatly increases their risk of developing gestational diabetes or suffering preterm birth or preeclampsia. And then, yeah, I mean, there are many stats. There's still, from a process perspective, a little bit of a lag from a development point of view. So, for example, postpartum care isn't provided as standard here in the UAE, which means that postpartum depression rates are 56% among women and 30% among men, so pretty high. Yeah, just to give you some examples.
Wow. Yeah. So are they not going to prenatal visits or getting their annual breast exam because those things are not available, or is it like an awareness campaign issue, or what do you think is the cause of this? Because in the emerged markets, if you will, we know about it, right? And so like what is the barrier in emerging markets for these types of things?
So again, it depends where you are. If you're based here in the UAE, where there's an overabundance of healthcare facilities, 3,500 hospitals and clinics for a population of 11 million people, which is high. It's not about a lack of access or affordability even necessarily, because most kind of essential services are covered by insurance. Things like mammograms, for example, would be. It's more about a lack of education and this prevalence of what's termed a culture of shame. So, no one wants to really talk about or engage with the concept of cancer. Cancer in Arabic translates into something that roughly means the terrible cancer. So even the words themselves have very negative connotations. The word menopause in Arabic roughly translates into the age of despair. So, yeah, a lot of negative connotations, and I think it's more about awareness. and education and encouragement, and allowing women to do things in a way that they feel really comfortable about it. So with privacy, with autonomy, with convenience, in as affordable and accessible way as possible. Then you go to places like Kenya, where you have women living in remote villages, and they maybe, if they have a mobile phone, it's an analog phone. Perhaps there's only one phone to the household, or even one phone to the village. It's a 5-kilometer walk to the nearest healthcare facility. There, it's much more about access than anything else.
Mm-hmm. And so, what do you think the solution is? Is it technologies coming out of the US or the EU going into emerging markets and helping? Is it through like nonprofit work, or is it through, do you think that it has to come from within those countries and those regions? How do we help them, these women?
Well, I obviously am a proponent of building things from the ground up within the countries themselves, which is what we've done with Nabta. We're very proudly by and for the Middle East, Africa, and South Asia. Every single member of our team is either living in, or was brought up in, or is from the region. And we're in 11 countries in 8 different time zones, very, very diverse. The region is incredibly diverse, even in terms of the Arabic spoken, for example, across the Middle East and North Africa. The Khaliji dialects in the GCC, so in the Gulf Cooperation Council countries, places like Saudi Arabia, the United Arab Emirates, is very different to the Arabic spoken in the Levant, so in Jordan, Lebanon, Syria, which is different again to Egyptian Arabic, which is entirely different to North African Arabic, which is predominantly Berber. So there are so many very beautiful cultural nuances here. You can only really build things that are appropriate if you're building from the ground up. For example, take the fertility monitor that we've integrated with our platform, which is manufactured by Fertility Focus in the UK. It's a vaginal fertility monitor. In a lot of countries here, and especially in more conservative countries like Saudi Arabia, it's absolutely forbidden to insert anything into your vagina before marriage. And so for women who wanted to learn about their fertility, and this is including things like tampons, wanted to learn about their fertility, maybe in anticipation of trying to conceive early on in marriage, they wouldn't be able to use a device like this fertility monitor. They'd have to use a skin-based sensor or other kind of tracking mechanism. And the extent to which it is not possible for women in Saudi Arabia to even consider using a device like this, how much of an insult it would be to suggest that an unmarried woman uses a device like this, is something you can only really get to grips with when you're sat working side by side with women from the region on a daily basis. I mean, there are many different examples. I think this is a region that is very family centric, and again, you can see that, for example, in the statistics related to the IVF market. So obviously, the MENA region is a tiny percentage of the global population, so the Middle East and North Africa, but it accounts for 1/10 of the IVF market, because having families here is everything. The entire society is structured around family. I think in the UAE, 98% of businesses are family owned or run. So, your inability to start a family is really a problem here. And again, until you live in the region and work in the region, you don't appreciate how family centric everybody is and how important this really is. So while I think there will always be a degree of imitation and utilization of technologies and processes and best practices that exist outside of the region, the only way that you're ever going to effectively build things that women actually want and need here is by building them in the region from the ground up.
And how would you create a business model when it has such a diverse GDP in that area, right? You're talking about people who have a ton of money, and then you're talking about women in Kenya villages, right? And so how does a startup, structure that business model?
I think the answer is in a very systematic way, trying to tackle one kind of pay or payee relationship at a time. So in the UAE, the payor is the insurance provider. So or the individual for things that aren't covered by insurance, or if you're on a worse form of insurance where you've got a high percentage of copay, or you're paying and claiming. So you have to structure things so that insurance providers are incentivized to cover what you offer in place of, or as well as, what the existing healthcare ecosystem already offers. And you do that basically by proving that you can reduce the costs in terms of the services that you deliver. Then you have a market like Saudi Arabia, which is a predominantly public market. It's about 80% government, 18% private, and then maybe 2% private institutions. So the army, for example, has its own healthcare. Some companies like Aramco, the big Saudi oil and gas firm, have their own healthcare. And so rather than building something where you are incentivizing insurance providers to cover what you offer, you're building something that's incentivizing the government to cover what you offer. So working with the local accountable care organizations to demonstrate that you can materially improve population health and reduce the cost of providing essential healthcare to local populations. So you deal with that there. And then the question of accessibility and affordability is another one entirely. There you're trying to shift the burden of paying for everything away from the consumer entirely, and or working with some of the existing mechanisms to make it as affordable as possible. So for example, we're in discussions at the moment with an international telecoms company to use one of their existing mobile-based payment systems to support very small subscription-based transactions for particular elements of our first clinical pathways or our marketplace of products and services. And we're adapting everything that we currently have within our app and our kind of AI-powered platform to be accessible via SMS and via, one of the kind of 2 or 3 apps that women with smartphones might have on their phones. So things like Facebook Messenger, Facebook Lite, WhatsApp, etc.
This is really fascinating stuff. And another thing that, I personally work on a lot is helping founders fundraise. And so investors are always looking for, multi-billion-dollar markets to enter into. And they also are looking usually for companies to be targeting the US market, because that's what they know. And so have you tried to fundraise for Nabta? And what's your experience been like with investors? And do you have any advice for maybe anyone else who's working in an emerging market trying to get funding?
So I think the perception of emerging markets is a couple of things that a perception of the US market might not be. Firstly, they're not established. They're seen as a little bit, and this is an outside perception. They're seen as a little bit more unstable. They're seen as very diverse. So it would be difficult, in the US, in theory, at least, if you build something, it can immediately be available to a several hundred million population of predominantly English-speaking individuals. Although I think there was a stat recently that showed that by 2040, 2050, Spanish would be the most widely spoken language in the US. Anyway, I digress. So I think the perception of emerging markets is that they're a little bit bitty and they're quite challenging. And that potentially the established infrastructure isn't there necessarily to support a rapid rollout. But the thing is, with emerging markets, you have a rapidly growing population, very youthful. Some countries have 70% under 25 in emerging markets. The next billion people are coming out of Africa. So you have a rapidly growing market, very youthful, very innovative, very technology savvy, used to change at a rapid pace, that are still today mostly underserved by the existing healthcare system. So if women were excluded from clinical trials until 1994, meaning today women are still 50 to 75% more likely to suffer adverse reactions to drugs, the vast majority of our populations are still excluded from clinical trials. 92% of clinical trials occur in the US and Europe. The vast majority of the remaining 8% occur in the Far East. So you have here a population that has got very little infrastructure, or less infrastructure than other parts of the world, that is not served by clinical trials and clinical research, that is growing very fast, that is increasingly technology enabled and connected. I don't think there's a more exciting market to be in. And also, again, wholly untapped from an intellectual property perspective. Nobody registers patents here. Nothing is protected here. You know, there's an opportunity to establish kind of an intellectual property dominance that, when the world wakes up to the fact that this is a broad and interesting market, you know, you already have a few companies who've been building from the ground up from the start that have a very kind of solid foundation and base there. In terms of your question around raising funds, so we were in a discovery phase for 15 months, conceptualizing our model of hybrid healthcare, deciding how we were going to build out our first clinical pathways to support faster time to diagnosis for women with specific underlying health conditions. We then raised a seed round of $500,000. We raised it ticket by ticket over about 18 months from 10 angel investors in total, which was quite an efficient way of managing our operational expenditure. And then when we moved out of R&D, or were on the cusp of moving out of R&D into a commercialization phase, we opened a Seed Plus. We opened that Seed Plus in late June 2020. I have since then reached out to 306 funds globally. I have sent teasers to 125. I've had 40 introductory calls, 44 declare no interest, 15 declare interest for Series A, and we've whittled down to just under 10 who are really serious about potentially investing in us, a lead, a number of co's, and then a number of strategic co-investors. And we're in the final stages of due diligence now with a number of those companies. We were advised, because of being a women's health technology company in an emerging market, female-led, female-oriented, still very, very, very much among the minority, to cast our net wide. So we did. A lot of things have happened in the ecosystem here in the last year. You know, pre-COVID, most of the VCs in the region predominantly invested into pure SaaS plays, so into e-commerce, marketplaces, logistics, fintech. There were a handful, like 2 or 3 specialized health tech funds, and they didn't invest in companies in the region. Only now are we starting to see health tech focused funds emerging, and they're raising, so they will be ready to deploy capital probably in the next year or so. So we were raising in a challenging year in a nascent market, but I think the tide is turning. You know, people are interested now in investing in health tech here in a way that they never were before. People understand that population health, in terms of immunity, in terms of the prevalence of non-communicable disease, are really relevant and can have pretty significant implications in terms of the likelihood of a pandemic to hit you really, really hard or not. So, for example, we just saw a research institute, the Sheikh Mohammed bin Rashid Institute for Communicable Diseases, being set up here, one of the first big research and development institutes in the UAE. There are a number that are following. I think the tide is turning in favor of health tech companies in emerging markets. And I think there is increasingly a push here towards diversity and inclusion. There's a very high percentage actually of female-led startups here. In fact, there are more female-led startups in MENA than there are in Silicon Valley. And yeah, a lot of women in STEM as well. 56% of graduates in the UAE are in STEM subjects are women. So actually, there's a lot of movement and development in the space. I think the next 5 to 10 years are going to be interesting and dynamic in a way that potentially the last 5 to 10 years were not.
Yeah.
So yeah.
Do you see a rise in femtech companies, or do you feel like you're the only one?
We are still the only femtech company in the Arab world. Now that the UAE has started trading with Israel, as have a number of other Arab countries, Israel, from an Arab world perspective, is formally included in the MENA region. And obviously, there's some really great femtech companies that are coming out of Israel, and there's a lot of R&D that is happening in Israel as well. So increasingly, there's more dialogue in the femtech space. There are a handful of other femtech companies that we're aware of that operate across the region, but a lot of them aren't actually based here. So, for example, Grace Health, which targets some parts of sub-Saharan Africa with a period and cycle bot, is actually, the team's based in Sweden, I believe. And there are a few others, but they're not headquartered in the region. So we're still very much among the minority in terms of women's health technology companies that are based in and working also for the region.
Wow. And, a lot of companies start in other continents, but they all call me up saying, oh, we want to come to the US. So a lot of European companies say, oh, we want to come to the US. Do you anticipate that your company is ever going to leave your, the space you're in? Or is that like home base forever? That's the company, this isn't just your jumping off point.
So eventually it will be a jumping off point, but we want to establish ourselves as a company for emerging markets first. So to go throughout the Middle East, Africa, and South Asia, and then maybe at the point at which we IPO, we will expand to countries in Europe, the US, possibly go into China. I get requests every single week from companies and individuals in China. There are a lot of fertility issues, 300% increase in miscarriages in some of the major, very industrialized cities in China in the past 5 or so years. So there's a lot of interest from other markets, but we see there's a lot of potential here and there's a lot of work to do here. I think we would have R&D headquarters. We already have one in the UK. We will likely in the next 18 to 24 months set up one in the US. But in terms of operational entities, we will predominantly be based here.
Cool. And what was like a barrier that you faced building Nabta Health that you didn't expect?
I think I'm always a little bit surprised or to be reminded that I'm a woman and that means something other than the fact itself.
Yeah.
This is still in many ways, although it's a very family-oriented society, and women are held in very high esteem, in terms of the nuts and bolts of business and trade, it's still quite male-dominated. Mm-hmm. And it varies from country to country within the region. But there have definitely been times when I have made significantly less headway than I'd like. And although I have tried to pin it on reasons other than the fact that I'm a woman, have eventually been unable to do so. There have been times where I haven't helped myself either. I have had investor meetings with very conservatively dressed, beautifully dressed actually, local Emiratis. And I've had the baby with me and I have whipped her out to breastfeed under a cover and have had the entire meeting with a breastfeeding baby. That's happened on many, many occasions. I've rocked up at competitions with babies in slings. I was actually with Eleanor. I did a panel discussion at the Amazon Web Services conference when I was already in labor with her, not in active labor, but a day or so before she came. And then I had my first panel discussion with the Dubai Business Women's Council 4 days after she was born. And we placed second in an AI competition, won $25,000 when she was 10 days old. And I think people expect you when you are, and I don't think this is unique to the region, when you're pregnant or have small children, to behave in certain ways, still, maybe to slow down, take time off, not have your small children hanging off you at all times. and subverting those expectations has been a necessary part of the course, but I think something that I wasn't expecting to get quite so many questions about.
Wow. You are a superwoman, by the way. Like that sounds such dedication to your work. And also like just I'm so impressed. What do you think about, this is my last question, and I'd love to hear any like last thoughts from you, but you know, one of the barriers for femtech companies in the US is that a lot of women have never bought a solution for their menopause symptoms, right? Or they, everyone knows about all these like fertility tests or IVF, but like once the woman has the baby, you know, like what are things that are even available to her? And so the femtech founders in the US and the EU have to bear the burden of like educating women like about the problem and then encouraging them to pay for this solution because they deserve it and they don't need to suffer. Do you think that that barrier is even higher in these emerging markets, North Africa, you know, Middle East, where women feel like even less educated about their own bodies and then less like inclined to spend the money, the little money they may have on themselves?
I definitely think the whole education and why is this important for you and why should you be making a proactive decision to engage with your diet and lifestyle is a barrier. It's actually why we've pinpointed several kind of key moments in a woman's life to engage with her on the topic. And I think it's why over 50% of femtech companies focus on fertility, because the first time a woman really becomes an expert in her own health is when she falls pregnant or when she doesn't.
Yeah.
You know, if you want to provide people with a lot of information about their cycle health, how it's a very good indicator, probably the best indicator for women of her overall health, how her hormone levels are related to potentially metabolic disorders, to her gut microbiome, to diet and lifestyle decisions in general, get her when she's trying to have a baby and she really wants to do something about it. Probably the other critical point is when women get a cancer diagnosis in terms of lifestyle change.
Mm-hmm.
But I think that's it's a big barrier here. It's actually one of the reasons why we changed our offering a little bit, or we evolved it even sort of like 4 to 6 weeks ago. Previously, we had been focusing exclusively on building clinical pathways that could, in the context of a specific goal, help a woman understand whether she had an underlying health condition. So you're trying to fall pregnant, for example, you're unable to fall pregnant. Our little AI-powered assistant pops up and basically does the 3 steps that a doctor would do to get you from symptoms to diagnosis. So triaging, monitoring, and testing. And we'll walk you through doing those things. And so we spent a long time developing this quite elegant set of clinical pathways, but we're coming up against several things. One of them being precisely this, you know, how do you teach women that what you're offering is really better? You know, how do you build that trust? How do you make them aware that they need it, particularly somewhere here where potentially the barriers to entry from a cost perspective are lower than they would be in other parts of the region where IVF, ICSI, traditional assisted reproductive technologies just wouldn't be affordable. And so we've added a marketplace of products and services to support women either post-diagnosis or in the context of a specific health goal. And the idea is that we make available to women in a very cost-effective way. So we've partnered with a local buy now, pay later platform to bring payment in installments to the region for the first time. We've taken things that women would consider paying for out of pocket anyway and made them more affordable and contextualized them and provided a whole kind of education layer around them so that, you know, a woman, for example, can see how, you know, if she's just had a cancer diagnosis, moving from traditional to clean skincare might be a good option for her and will allow her to still effectively manage her skin and access some form of self-care during her chemotherapy, whether it's helping women who are pregnant for the first time access prenatal courses, postpartum meal plans, so that they are giving their baby and their baby's gut microbiome the best possible chance of development by keeping themselves healthy and having a balanced and varied diet. So we changed our offering to I guess give us multiple opportunities to tag on to the consumer spending decisions that women would make anyway, like little kind of tools, tips, and opportunities for education.
In some countries, is there a barrier of like needing their husband's approval to like get this kind of resources?
So it's an interesting question. I think that manifests, there are various manifestations of preference, I guess. Here, for example, a lot of payments for online purchases are made using cash on delivery because women don't feel comfortable giving their name, their phone number, their bank account details, men and women, because it makes them that little bit more traceable. So a lot of online transactions are supported by cash on delivery, which is a very unique model of payment, or it's unique to the region. Until 2019, women in Saudi Arabia couldn't decide how they wanted to give birth. So if your doctor or your guardian said you're having a C-section, you'd have a C-section. If one of the potential outcomes, there was a complication and the doctor put forward to the question, are you comfortable with us proceeding with a hysterectomy? You didn't get to make that decision for yourself. That was made by your doctor or your guardian. So there are some places in the region still where women aren't able to make decisions for themselves. That's changed now, by the way. In terms of the freedom of movement and everything else for women in Saudi Arabia and other parts of the region, there's been a lot of progress in the past couple of years, and I think everybody here would attest to that. But yeah, again, the whole purpose of Nabta is to do everything with the prioritization of privacy, autonomy, and convenience as much as possible, acknowledging that this, even over affordability in the GCC in particular, is what women are really looking for. You'll have members of prominent families here who will have clinics closed for the entire afternoon, fertility clinics, so that they can visit and be seen, but not be seen, if you get what I mean. So the privacy factor is really important.
Interesting. If someone wanted to start a femtech company, what's an area in women's health and wellness you think still needs innovating?
Oh, that's an interesting question. Gosh, there are so many, aren't there?
You can also give us a country that you think needs more femtech innovation in.
You know what? I think it's really important always to remember that technology at the end of the day is an enabler. And there are many, many aspects of women's healthcare that could be improved in little but significant ways. And it varies completely country to country. I think probably here in the UAE, let's take the UAE, one of the biggest gaps is in postpartum support, helping women to understand what, so firstly, what good decision making looks like in terms of pregnancy and birth. C-section rates here are very high because C-sections earn doctors more money than vaginal deliveries, and because they're more convenient. But the World Health Organization recommends C-section rates of 15%, and the average in the UAE is 50%, up to 80% in some private hospitals. And that has a whole load of knock-on effects. For the mother, from a recovery perspective, you go from like a week, 2 weeks to 6 weeks. In terms of the risk associated with future deliveries, if you have a particularly thin scar or stretched scarring area, in terms of the gut microbiome of the infant. So there are 3 key factors that affect the gut microbiome development of a baby in its first year of life. The number 1 is vaginal delivery. Vaginal delivery populates the baby's gut microbiome with lots and lots and lots of good bacteria. It doesn't happen, that population doesn't happen. The second thing that adversely affects the microbiome is if the mother intrapartum is on antibiotics, so she's on antibiotics while she's giving birth. And then the third thing is whether the baby is breastfed or not, and exclusively breastfed for the first 4 to 6 months of life, which obviously positively impacts the microbiome development. So helping women to understand how their birth preferences impact their own and their baby's health, and then putting into place a really like structured support mechanism that prioritizes the mother almost over anybody else in the first trimester or the fourth trimester, the first trimester postpartum. So, you know, what does perineal recovery look like? How can you start exercising again? What do good dietary decisions look like? How do you birth-proof a marriage? How do you make the addition of a family member easier for the family in general? What are the critical checks that you need to look for? What does an infection feel like? Again, episiotomy rates are really high here. In some facilities, over 80%. So there's a huge, a very high prevalence of secondary and tertiary tears and also of infections. So yeah, I mean, there are a dozen different small things that companies could do here to support women postpartum that would make a big difference. And for every country, there are overlaps, and there are also things individually that would make a big difference.
Yeah.
Somewhere like Kenya, there's a very high rate of maternal death and also infant death, largely due to the lack of proper antenatal care. So in Kenya, maybe the focus should be more on educating women in the run up to falling pregnant, and then holding their hands and providing them with remote care during pregnancy itself. There's two examples.
Yeah, absolutely. Both of them absolutely need innovating. And I love how you're talking about, like, based on the market that you're in, it depends, right? So, and what do you think that the femtech industry as a whole needs the most right now in order to be successful?
Probably more capital.
Mm-hmm.
Is the number one thing. I do think creating something of a global movement is really important. The perception of us folk over here in the middle of the desert is that a lot of the kind of chatter in the femtech space is very Western oriented. So very much happening in the US, very much happening in Europe. And I think creating a more global and inclusive movement that has, you know, voices from all over the world, and starting to actively invest in and support companies that are building things in for the niches and for the underserved and for the untapped is the way that women's health and the changes within the sector will really start to gather pace. Mm-hmm. So capital and more inclusivity in terms of a global footprint.
I love it. Sophie, you are amazing. You are literally the shining star over there for Femtech, and we thank you for all your efforts. And this is a great conversation. Thanks so much for your input today.
Thank you for having me, Brittany. Pleasure.